So now that we know what the principle of respect for autonomy is, we'll look at questions to see if a patient is in the right condition to be able to make autonomous decisions. So the principle of respect for autonomy allows us to ask general questions, and these are some questions that we can use as a guide depending on the patient situation and the medical situation. So some examples are things like, is the patient autonomous? Or is their autonomy stable or fluctuating? So patients with like early stages of dementia, there are times of clarity, but also like when they're sundowning, they may not be in the right state of mind to make decisions for themselves. So for patients like that, has their autonomy been assessed on a renewing basis? Is the patient legally autonomous? Like, are they a minor or are they of age? Has the patient been informed of all of the details of the experiment or their patient care? Have they waived their right to information? Or has, and the one on the left, the last one on the left side, has the patient been given adequate, complete, and truthful information? And I think the word truthful is very important because sometimes, depending on how we want the patient to make their decision so that our patient care is easier, I feel like sometimes it's easy to kind of bend the truth for the patient, for our patients, because we know that they don't know any better. So are we being truthful to them about all of the information revolving around their care? Does the patient have the capacity to understand this information? So again, like the dementia patients, are they, or minor patients, do they have the capacity to understand? And once it's been explained to them, does the patient actually understand the information? Maybe a little bit of teach back might be good for situations like this to make sure that they're able to say it in their own words and fully understand the information that they received. Does the patient have internal or external constraints to voluntariness? The next slide is going to go into details of the internal and external constraints, so we'll look at that a little more in the next slide. And can any of these constraints be ameliorated? Like, can they be improved on? Can they be fixed? Has the patient been influenced, right? We don't sign consent forms when a patient is on hardcore painkillers because we know that they're not in the right state of mind. Similarly, has the patient given free consent, and has the consent fluctuated? I know for us on our labor and delivery unit, our consent forms, like if they've been in labor for more than 36 hours, which in itself is really sad, but if the consent forms were signed 3 days ago, then we have to get new consent forms because they expire after 3 days. I'm not sure if that's how other units do it, but things like that. And also, people can give consent and they can also take that consent back. So these are some questions that we can ask to determine the principle of respect for autonomy for our patients.